아, 안녕하세요. 매일매일 운동하기를 실천하고 있는 동탄 왕코입니다. 오늘은 1월 2일 토요일입니다. 연휴 잘 집에서 방콕하고 잘 계신지. 오늘 저는 새벽 출근하고요. 낮잠 자고 저녁 먹고 좀 쉬다가 지금은 밤 9시가 넘었습니다. 스트레칭을 좀 했어요. 등이 너무 뻐근해서. 근데 확실히 진짜 일을 하면은 피곤합니다. 운동이 하고 싶지 않아요. 쉬는 날 운동하는 거랑 출근해서 운동하는 거랑은 차원이 너무 다릅니다. 그리고 낮잠 자고 일어나는데 못 일어나겠어. 너무 피곤합니다. 일단 스트레칭을 했으니까 팔굽혀펴기랑 스쿼트, 팔굽혀펴기랑 스쿼트 2개 할게요. 바로 시작하도록 하겠습니다. 역시 운동을 할 땐 CNN이죠.
Friday brought a new year, and with it, another tragic milestone in the COVID-19 pandemic, with the U.S. surpassing 20 million total confirmed infections. It's a reminder that the virus will keep ravaging parts of the country until ongoing vaccine efforts help to slow or stop the spread. And there lies a challenge. Health officials in several states report difficulties in planning a vaccine rollout with no federal mandate in place dictating how to administer the vaccine. The result has been a flawed distribution, leaving vaccination figures far below the Trump administration's goal. Utah Senator Mitt Romney, a Republican critic of the president, called that inexcusable. Texas reports the state has only distributed a third of the vaccine it's received as of Friday, and some hospitals are trying to overcome the logistical challenges of administering the shot, says Michigan Dr. Rob Davidson.
Well, there have been a few hiccups. They're trying to get as many frontline healthcare workers vaccinated as possible. We're doing a little bit of a change up in how they're doing the scheduling so we can get more people. And now reaching out to clinics outside the hospital to get those folks vaccinated, and then working with local health departments on the next level, the people over 75.
Data from the CDC shows New York is overperforming on the vaccination front. Friday figures showed 32% of New York's allotted vaccine doses have already been given. That is well above the national average of 23% shots administered. But the real crisis point remains out west, in California, which set a new daily record for COVID-19 deaths on Friday, as one state official warned that California is on the brink of catastrophe. This New Year's Eve crowd gathered in LA County, protesting masks and limits on religious gatherings.
It's so disheartening to see some of these people that feel overprivileged having parties when so many people are struggling. I just want to take a moment, though, to thank who I consider the unsung heroes of this pandemic. And these are the average Americans who have sacrificed their family time and their jobs by doing the right thing day in and day out, by wearing masks and distancing.
Dr. George Rodriguez tells CNN some medical facilities in his region are using hospital gift shops and their chapels to care for their patients. This weekend, health officials will be watching for more reported cases of a fast-moving COVID-19 variant.
It's still the same virus. It's not different in that. It's just that this new lineage here may be transmitting a little better.
Early research suggests the new variant spreads the same way, meaning social distancing and masks offer the best protection. And important to mention that New York is not alone on the list of states that seem to be outperforming others in terms of vaccinated its residents. In fact, Florida also there at the top of the list in terms of the percentage of vaccines that have already been administered. But it becomes clear here, Christy, that the country's certainly not where it should be in terms of building up that vaccination defense against this pandemic. Here in New York, though, the mayor saying that he does have high hopes that there will be at least 1 million people vaccinated by the end of this month.
All righty, Polo Sandoval, good to see you. Thank you so much for the update. CNN medical analyst Dr. Megan Rainey is with us now. She's an emergency room physician at Brown University. Doctor, thank you so much for everything that you do, for being with us now. I understand that we cannot overlook what's happening in hospitals right now, how overwhelmed they are with the numbers that we're seeing over the last week or two. I understand that you had a moment watching the ball drop on New Year's Eve. Help us understand the emotion that you were feeling and why.
Yeah, so I was actually watching CNN. I was watching Anderson Cooper and Andy Cohen, and I just started bawling. I haven't really cried the whole pandemic because I'm an ER doc, right? This is what we train to do. And I think watching the year change hit home to me how horrific 2020 had been. I've lost a bunch of colleagues. I have a bunch more who've been really sick and hospitalized. I have many friends across the country who've been ill. And our country has suffered. And I know that I'm heading back into the ER in a couple days, and it's going to be the same thing again. We're looking forward to a couple of really tough months ahead of us, but the fact that we finally have a light at the end of the tunnel, it just gave me a space to feel all the sadness for everything we lost in 2020.
We appreciate everything you do. I hope you know that that is not lost on any of us, and we are always thinking of you and praying for you and your teams everywhere, because you are the ones that are helping keep people alive, and we cannot imagine what it's like to be in your shoes. So I just want to make sure that you understand that from our point of view here. I do want to ask you about this new variant, because it's showed up in the UK. It's now shown up in 3 states: California, Colorado, and Florida. Is there any gauge as to how long it's been in the US and what it means for the fight against COVID now?
I wish that I could say that we knew how long it had been here in the United States, but we do a really bad job of sequencing the genome of COVID-19 in this country. Britain sequences a high percentage of its tests. We sequence a tremendously low percentage. We know that it first appeared in the UK in late September. I have trouble believing that it didn't get here soon after. We've had transatlantic flights going back and forth the entire time. And of course, we now know that it's been found in multiple people in the San Diego area. We think it's multiple people in Colorado. Again, I have trouble believing that it hasn't been here for months.
So Dr. Fauci says that the vaccine that is now available will tackle this new variant. Are you as certain of that as well? Okay, I mean, have there been any trials for that?
So there have not been trials, but the mutations on the spike protein are of a type that should not make the vaccine ineffective. And I will say that is one small piece of good news in this disaster of a transition, right? We have more cases, we have more hospitalizations, we have travel that's going to lead to further surges in January. Now we have this new version of the virus that's going to make our hospitals still more full. The one piece of good news is that so far, the data suggests that the current version of the vaccines will work against this virus. It does, of course, make us concerned that in future months, there will be versions of the virus that the vaccine doesn't protect against, but it's why it's so important for us to get vaccinated quickly, so that those future versions of the virus don't have a chance to mutate and appear and become dominant among our population.
And there have been a lot of questions about why more doses of the virus, or the vaccine rather, have not been made available to states. Do you chalk that up to the distribution process itself? Is part of it possibly the lower numbers we're seeing, people who say they don't want to get the vaccine? I mean, what is your assessment there?
So we have a little over 12.5 million doses that have been distributed to states. Only about 2.5 million doses have gotten into arms. That is a logistics failure. It is similar to the failures that we've had around testing and around PPE. It is because we did not invest federal money or effort into creating distribution plans. You know, we funded Warp Speed for billions of dollars very appropriately in order to develop vaccines. We should have started to invest into logistics and last mile programs at the same time. Instead, we're asking already overworked and overwhelmed hospitals and public health departments to fill the gap. We just don't have the staff. We don't have the funding to develop the plans. This is not surprising that we're failing in the logistics, but it's disappointing. And it, just as with many things in this pandemic, it could have been prevented with a little bit of foresight.
Dr. Megan Rainey, thank you again to you and your teams for everything that you're doing. We appreciate you very much.
Thank you.
Absolutely. And the U.S. and Iran are ratcheting up military activity in the Persian Gulf ahead of the anniversary of a U.S. drone strike that killed a top Iranian commander. CNN military analyst Colonel Cedric Light is going to join us next to talk about it.
There's something evil here. At some point, I'm gonna have to talk about it.
burn.
I really enjoyed that one today.
Election night in America continues. 2 Senate seats. One state decides. Will Georgia's runoff flip the Senate? Election night in America continue. Coverage starts Wednesday on CNN.
A mask can say a lot.
여러분 진짜 토할 것 같아요.
But even more about the person who doesn't.
I'm Matt Rivers in Mexico City. This is CNN.
아이고 죽겠다.
When you travel the world, make sure the world
못하겠어요. 너무 힘들어. 일단 팔굽혀펴기 10개 하겠습니다.
check in, log on, and get connected with all of the latest developments at your fingertips.
어디서 이렇게
CNN partner hotels, connected to your
땀 냄새인가? 이상한 냄새가
Coronavirus is
납니다.
affecting an entire country, the world. Are we ready? In the beginning of outbreaks like this, nobody knows what's happening. We're determined to keep reporting the story.
That's that worry, because that seems like what worries the American people.
These are the moments where our humanity really does shine through. That's the hardest part.
It's heart-wrenching.
Dr. Sanjay Gupta, CNN.
This is CNN. More people get their news from CNN than any other news source.
Right now, the U.S. and Iran are ratcheting up tensions in the Persian Gulf. Because tomorrow marks the 1-year anniversary of the U.S. drone strike that killed top Iranian commander Qasem Soleimani.
Now, U.S. officials say the potential of an attack from Iran is the highest it's been since his death. The U.S. flew nuclear-capable B-52 bombers to the Middle East as a show of force, and a U.S. official now tells CNN some Iranian maritime forces in the Gulf have ramped up their readiness levels. They're not certain, though, as they watch, whether this is for offensive reasoning or defensive reasons.
Joining us now to talk about it all is CNN military analyst Colonel Cedric Layton. Good morning, Colonel. Happy New Year. Let's start with Iran, though, because both the U.S. and Iran seem to be ramping up tensions in the Persian Gulf. And it comes, as Christy mentioned, the 1-year anniversary approaches of the U.S. striking Iran's most powerful military figure, General Soleimani. So the head of Iran's elite Quds force just suggested Friday that retaliation may come from, quote, people in your own house. Do you believe there are any credible or imminent threats?
Well, I do, John. Good morning and Happy New Year to you as well. This is one of those times when there are a lot of different actions that the Iranians could take. The threats are very credible. We've watched the U.S. intelligence efforts have been very focused, actually, on the transfer of weapons, especially rocket-related weapons, from Iran into Iraq. So several of the threat paths that we could see include possible attacks on U.S. forces in Iraq, possible attacks in other parts of the Middle East. Certainly, there's a possibility of Houthi rebels using their weaponry against U.S. forces in the Arabian Peninsula. So there are a lot of different possibilities. On the maritime side, we could definitely see a lot of actions from the Iranians in regard to U.S. military efforts in the Persian Gulf, especially our naval forces, which are quite vulnerable actually to small boat attacks by the Iranians.
That's right, we've seen that before. An escalation could be difficult to contain. President Trump reportedly asked for military options to deal with Iran back in November. Now, Trump's last day in office is just a little more than 2 weeks away. But if the president were to make any moves, would it be standard for Biden to be briefed or consulted before it happens?
Yes, it absolutely would be. I worked on the presidential transition from President Clinton to President Bush, and
발굽부벽이 20개만 하고 끝내겠습니다.
to
너무
make
힘들어요.
sure that any types of operations were briefed to the incoming team. There were a lot of things that involve budgetary issues, which are kind of standard processes when it comes to the transition, but actual military operations that are either in the planning stages or about to begin, they are always supposed to be briefed to the incoming administration, and that has to be the case. Otherwise, the transition is not a transition at all.
So you would presume that would transcend any bureaucratic infighting or
못하겠어.
resistance we've seen between the DoD and
오늘
the
여기까지만
administration.
하겠습니다.
Well, certainly in the past, it has
토요일
transcended any
즐겁게
type of
보내세요.
bureaucratic infighting of that type. But of course, we are, I think, living at different times, and it's my big